Well, thank you all for coming today. My name is Adam Klass. I'm the Chief Technology Officer with VigiLanz Corporation. We've also got Dave Levin here, who's a Chief Medical Officer with Sansoro Health, and we're going to be talking a little bit about data exchange and API integrations today. So just a little bit of background on VigiLanz. VigiLanz has been around for 17 plus years. I've been with the company since 2001. I'm one of the founders and developers of VigiLanz. We have roughly around 420 hospitals here in the US that are using our real-time clinical surveillance and analytical services. We do this as a software as a service, so there's no hardware and software needed in order to use our services. We do quite a bit of work with Klass, which is the healthcare IT ratings agency, and I can let you know we stack up compared to some of the other surveillance vendors in our space. Lots of hospitals and systems using VigiLanz. We've got 100-bed hospitals. We've got 1,500-bed hospitals like Jackson Memorial down in Miami. We have very large systems like HCA. So we've worked with all the major EMR vendors over time, as well as proprietary vendors as well. And really how VigiLanz works is, the goal of VigiLanz is to get as much of a clinical data footprint as we can into the VigiLanz private cloud. We want to get that information into VigiLanz as timely as possible, and we're listening for things like your admissions, discharges, and transfers, your medication orders, your lab test results, preliminary and final micro susceptibility results, drug administrations, procedures, surgeries. The more information that can come into this private cloud, the more types of things that we can do around surveillance of that data. In the past, what we've normally done is brought this information via HL7 and flat file, but we're going to talk obviously a little bit today about how we've evolved in this process using, working with our partner with a product called VigiLanz Connect. This process is listening for information 24/7, and then what VigiLanz has done is it's designed a process that standardizes and normalizes this data and gets it into a format where we can start to ask interesting questions of that data. We have two core rules engines that run in the background that are very clinically focused. One is very much around dosing of drugs and looking at drug and lab relationships. And the other is an event-based rules engine that really allows us to follow any sort of clinical use case that you can possibly think of in the clinical healthcare setting. And the real value of that rules engine is the more data that's coming into the platform, the more types of things we can track for you. So getting that information out of the electronic health record really becomes critical to having success for the certain type of services that VigiLanz has to offer. VigiLanz also has a data warehouse, so multiple times a day we're rolling this information up into a singular location where our hospitals are able to do analytics across their entire system, looking at productivity, outcomes, and performance. VigiLanz also has a set of web services, so they're able to share the intelligent output of these rules engines with other vendors that we're partnered with or other healthcare organizations as that information is needed and integrated back into their systems. We have a set of services that sit within this platform around things like pharmacy and antimicrobial stewardship and infection prevention. Those are things that we see as our foundational services that VigiLanz offers. But we're also doing quite a bit in the area of machine learning with predictive intelligence, trying to look to see what's coming around the corner for things like sepsis and readmissions and acute kidney injury. We also offer what are called quality and clinical services. So any clinical use case that you want to track in near real time, we're able to put rule sets around that information to get into workflows, to get into analytics and reports, and then back to your clinicians so they can really help their patients. We also have a safety surveillance service, also being able to log all of your safety events, track those throughout the hospital. We have a product that does that now as well. We have reports and analytics that sit on top of all of these services, and then we have a full-time IT and clinical staff that fully supports and maintains these services. So for 2 years running now, we are the category leader in our foundational services, antimicrobial stewardship, infection control, and pharmacy surveillance. So we're very excited about that. Just to talk about a little bit more detail on some of the things that we offer in these different service offerings here. So any sort of best practices for pharmacy, whether it's IV to PO conversion, therapeutic drug monitoring, duplications of therapy, identifying and preventing adverse drug events in real time, really giving the pharmacists the workflow and intervention opportunities that they need in order to do their day-to-day needs within the hospital to help their patients. Antimicrobial stewardship, taking their stewardship program, getting it down to a set of rules so they're able to do that type of surveillance in real time. then offering them antibiograms and dashboards and drug utilization, reporting to the National Health Safety Network in a direct way from VigiLanz to NHSN. So anything we can do to save the stewardship folks' time, we're able to do that within that service. Real-time isolation management, HAIs, MDROs, reportables for our infection prevention service, reporting to the National Health Safety Network, whether it's for their events or their denominator data, and just really a whole set of tools that we've built out over the years to really sort of make their lives easier so they can help their patients and really focus on prevention. And I talked a little bit about what we do in the area of predictive with our machine learning, safety surveillance, and then with quality and clinical services, we've really started to build this out more and more over time, where we're doing things around things like opioid stewardship, acute kidney injury, readmission management. These are all things that we can do with our discrete services. So in order for all these services to work, we need data out of the EHR. So for many years now, we've been working with HL7, perfectly fine to work with HL7. The pros are, it's a very commonly accepted format. It's been around for years and years. Everyone's familiar with it. Exchanges really well. It's near real time, which is very valuable. Some of the challenges are really sort of generated more on the hospital IT side and on the vendor side as well. What I was told many years ago is if you've done one HL7 interface, you've actually done one HL7 interface. So it's a standard that gets interpreted in different ways. Data is stored in different elements within the HL7 messages. So there's a lot of validation that has to go along from the vendor and from the hospital IT group to make sure that the data is exchanging in the way that we need it to exchange. There's a lot of hospital IT support and maintenance that goes into these interfaces. They have to stand these interfaces up, they have to support and maintain those, they have to have an interface engine, so there's a lot of overhead there. It does take a lot of hospital IT time in order to build these interfaces as well. And there's a significant cost that goes along with that goes back to the EHR vendor as they need more data to be exchanged across these different vendor organizations. And really this clinical data variability and availability. So as VigiLanz has these 420 plus hospitals, some hospitals are sending us quite a bit of data, some are sending less, and it limits the opportunity to really use the full platform that VigiLanz offers. What's really valuable with this, with API data acquisition, really at the top here is you really have a unified data model. So as this information is coming to us in a standard format, it's always going to be sent to us the same way, whether it's Meditech or Cerner or Epic or whatever the EMR may be, all the data comes to us the same way. So as a vendor, you're able to develop your programs against a unified data model. It is in near real time. And really the value of if you build out a full API footprint is getting that full clinical model from day one, so you're not having to circle back with health organizations and getting more data over time. That hospital IT team involvement becomes significantly less as you use these APIs. The cost is also significantly less as well because you've removed the maintenance and support that goes into interfaces as well. One of the cons really is this lack of adoption and awareness. On the healthcare side with APIs, it's still evolving. People are still sort of trying to learn what APIs are and how they can be used. So there's some challenges there that we continue to work through. So we have roughly around 30 health systems now that are using VigiLanz and APIs together. We have many that are implementing right now as well. And we're really starting to see some significant reductions. We're seeing about a 10x reduction in hospital IT time, whether it's validation of data, having to stand up interfaces, the weekly calls that we have to have with the IT groups when you're exchanging HL7 or flat files. That really goes away using APIs, because all this information is being returned the same way. We're also seeing a significant reduction on the cost, because they're not having to build out all of these interfaces and files, and sometimes bring consultants in to do this type of work. On the VigiLanz side, it's been great as well. We're seeing a 2x reduction in our development time, not necessarily our implementation time. In some cases, it's taking a little bit more time because our clinicians actually have more and more data to work with, which is actually a good thing. More time to build rules, more time to work with clinicians, but we're making that up by having this reduction on the development side, which is really key. We're also seeing a reduction on the contract signing to a go live. So as you sign a contract with a health organization, that IT group is very busy. They've got a lot of projects, and you have to get slated in, and there's hours that go into building out HL7 implementations. Using the APIs, we're able to get started a lot quicker, and we're able to get data access a lot quicker as well, so we're actually seeing a reduction from that contract signing to the go live as well by 2x. And really getting this full clinical data footprint from the initiation of the implementation is really a key as well, that we've been able to implement all of our services right away for a lot of our hospitals. And with that, I'll pass this over to Dave.
Well, Adam, thank you for that introduction. I love co-presenting with VigiLanz. First of all, it's a tremendous product, and as you can see from the Klass ratings, it's solving really important clinical and business problems. The other reason I love working with them and presenting with them is it really demonstrates the power and the advantage of an API-based approach to integration. And you really already heard this from Adam. It greatly reduces the amount of time that's required to deploy the solution, and that translates into a cost savings. But more importantly, it translates into a better user experience, a richer data set that takes a product that's already really good and makes it even better. And this notion of speed to value. So we're dealing with really important clinical problems here, and the sooner we can get these solutions in place and begin to impact the outcomes, the better for everyone. As Adam has said, really, we've partnered together because our mission is to deliver rich clinical data in real time to robust enterprise applications. So it's really a perfect marriage in many ways. And as Adam pointed out, there's some real obvious advantages, and I can make these claims, but VigiLanz has demonstrated in the real world that it's true, and they've done it repeatedly over the last few years. So you can get almost any clinical data. You can deploy in a much more rapid fashion. It is near real time. It's also bidirectional, so it gives you the opportunity, if you choose, to close the loop by putting things back into the clinical workflow as well. It's enterprise scale. So not only is it easy to install and very reliable, but it will scale to very large enterprise level kinds of applications. It was designed that way from the beginning. No surprise, this is the same technology that powers the rest of the digital economy. So while, as Adam has pointed out, APIs are relatively new to healthcare, they're not new. They've been around for many years. I think the other thing that's very exciting is we've gone in healthcare from going, well, what exactly is an API, to seeing now the federal government mandating the adoption and use. So clearly this is a technology that's here to stay and is only going to grow in its power and sophistication. I want to point out two other things. This approach brings a kind of agility. And so as Adam and the team evolve the product, as they identify new opportunities or the need for data that could dramatically improve performance, our ability to quickly develop and deploy that makes us and them much more agile and delivers value quickly to customers and end users. The last thing I'd like to share with this group is we're announcing this week FHIR compatibility. So this will now give Sansoro what I think of as the both and, the best of both worlds. So where FHIR is suitable and will deliver what's needed, it's a great way to show up and plug in. But let's face it, for sophisticated applications like VigiLanz, very often the needs go beyond that. And so the power of Sansoro's API is that we bring both. So FHIR when you need it, custom solutions when that doesn't meet the need. So to summarize all of this, this is really not about APIs. It's about solving important business and clinical problems. And I think the VigiLanz-Sansoro partnership is probably one of the best examples anywhere in healthcare right now about how this can work.